All right, well, it looks like most people are in and connected to audio, so we'll get started. Well, welcome everyone again to the third session of our PCA HCCN Professional Development Series. We're super glad that you're here with us today. We've got an exciting session for you planned. Today's session is specifically focused on health professions education training plans as a part of your overall comprehensive workforce plan. So we're excited to chat with you guys about that today. My name is Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and you guys are in luck because we have the entire STAR Center team with us today. So as I mentioned, yes, you guys know I'm Suzanne. We also have Michelle, who is going to be presenting with us today, and then Mariah, who is running all of the Zoom and everything, and Helen and Alex are with us today, so we'll be active on chat. You might not hear from all of us or see all of our faces today, but we are all here and we are glad to be with you. Today we have a guest presenter, and we're so thankful that Nathalia Drew, who is the team lead on the PCA team with BIPIC, is here with us today. And so you'll hear from her a little bit later, and we are just so grateful that she's here to share some wisdom and answer your questions later from a BIPIC perspective. So most of you all know exactly who we are, but just in case we have some new folks, we always like to introduce ourselves and our organization. So we are the Association of Clinicians for the Underserved. We were founded about 25 years ago by alumni of the National Health Service Corps. We have changed a bit over the years, but our mission remains the same, and that is access to care for underserved populations and the support of clinicians who are serving those underserved populations. And so we do that through a variety of different methods, and we have a bunch of different programs, including our Vision Services Care Program to help health centers establish vision care programs at their health centers. We also have a Suicide Safer Care program for training for both staff as well as patients. And then the biggest program that we have at ACU is our STAR Center, which stands for Solutions, Training, and Assistance for Recruitment and Retention. And that program is a national cooperative agreement funded through the Bureau of Primary Health Care, and we've been doing that for about 8 years now. We are one of the 21 NTAPs who focus on a variety of niche areas affecting the health center program. And most of you know that we have a ton of tools and resources available to you at absolutely no cost at chcworkforce.org. We are always coming out with new resources. So if you're not already, we encourage you all to sign up for our newsletter so that you can stay abreast of all the resources that are coming online practically every single month. So, so check us out. Just a little housekeeping items for you. The session is being recorded, and it will be sent to everyone who registered, as well as available on our website. Feel free to use the chat box to ask questions, share thoughts and ideas as we go along. We really want this to be a collaborative environment, so we welcome that interaction as well. Feel free to send a message to Mariah through the chat or through her email at mblake@clinicians.org if you're having any technical difficulties. And please do fill out the evaluation at the end that'll come up right as we're wrapping up in our questions or Q&A session there. That really helps us out and ensures that we know how we're doing so that we can continually improve our content in our sessions. And just before we go into our icebreaker, y'all know that the purpose of our professional development series is really to provide a space for professional development and also collaboration to support workforce R&R, recruitment and retention efforts at your PCAs, at your health centers, and to allow you all a space to be able to learn from us here at ACU, as well as those that are also in our virtual space here. So how are we going to accomplish this? How do we accomplish this through the series? So we've got these train the trainer sessions, learning how to present content and use the STAR Center resources in TTA and workforce programs, really building a network, allowing you all to hear and see what you're doing, and really becoming workforce leaders in your states, and really moving the needle when it comes to your workforce initiatives around the country. We also want to keep you informed. You know, as workforce leaders, as workforce trainers, you know, you are benefiting from the knowledge and knowing what your colleagues are experiencing and hearing about also some promising practice. And then finally, bringing you inspiration, bringing you new conversations, bringing you things, up-to-date content, especially things like what we're doing today. We're bringing in partners to share information that is relevant to what you're hearing, what you're experiencing, and the information that you need to do your work every day. All right, y'all, we're gonna do a Mentimeter icebreaker here. So y'all know the drill. You can take your smartphone out and take a picture of that QR code, or head over to menti.com and enter that code, or you can go into the chat and just click right there and get directly there. So just a little icebreaker there for us. All right, menti.com, 5578-7786, or click on the link in chat. All right, you guys are already here. So what is your morning wake up beverage of choice? Are we team coffee? Are we team tea? Or do we like some soda? Or do you just drink water or nothing? It looks like coffee is in the lead with almost double the people that drink coffee than tea, although 7 tea drinkers in the room here. I'm actually a little surprised at that. As a tea drinker myself, it's always interesting to see who else likes tea. And frankly, this none. So you don't drink any caffeine to get you going in the morning. Y'all are the rock stars and the superheroes there. So thanks so much for participating in that. Always interesting to see that. So, all right. Thank you for participating. I am going to stop sharing and then hand it over to Michelle, who is going to do the bulk of our content today. So take it away, Michelle.
Sounds good. And if everyone can just give me a moment just to share. So there we go. I think everyone should be able to see my slides now. Is that okay? Perfect. I never know, because sometimes you can see it on your screen, but you're not sure if everybody else can see what you're seeing. So just to let everyone know, we're going to go through, oh, I don't know why it skipped. We're going to go through just some general content, and then I will go ahead and pass it over to Nathalia, and we definitely want to make sure to leave more than enough time for everybody to be able to ask their questions. But if you've attended any of our other trainings, you've probably seen this slide of, you know, what is the definition of a comprehensive workforce plan? So when this was being written up, definitely wanted to keep it broad so that it really worked for everyone. But one of the key parts of this is really these different components of having a vision, doing an assessment, retention, recruitment, development, and action plan. And what we're going to see in the next few slides is that the strategic workforce plan, the focus on health professions, education, training, goes in your comprehensive workforce plan. So we have a few other graphics that we created on sort of connecting it to these different components, but that's one of the things that we really wanted to be able to just make it clear that it is a part of it. And we do have it within the definition under the development part, because it's very much that idea of you're developing your workforce, you know, you're going in and building a pathway for it. And of course, you can always download, I should have probably said that, our definition. You will get these slides. You can click on here, or it is on our website. So with saying that, I do want to clarify that the comprehensive workforce plan is not the health professions education and training plan. So it was recently referred to as strategic workforce plan, but it can also be referred to as the HPET plan. And the reason that we're saying they're not the same is because HPET is really a component of your workforce plan. It doesn't make up your entire workforce plan. So what we saw with the definition before was very much that you have many different components when you're looking at the entire workforce. And this is one of the key areas that is fundamentally important, again, why we put it within that development piece. So we recently created this graphic, and I do want to call out Helen, one of our training specialists who created this. She did an absolutely amazing job, just visually very beautiful. But it also goes into how all of this fits together. So it goes directly with the definition. And again, you have the vision, the assessment, the retention, recruitment. And then when you get into that development section, that's where you have that subcategory of the HPET plan, but it is a fundamental part of it. So in order to have a full comprehensive work, and obviously ending with the action plan, because you need to know, when are we going to put this into place, all of those things. But as we go through the definition, as you have a full comprehensive workforce plan, the HPET plan is the part of it that needs to be there. So that's really the key point that we wanted to highlight with these two slides. And then we're going to go just through a couple more slides that talk about the importance of this and ways that you can also discuss this with your health centers, for them to prioritize the HPET plan or the strategic workforce plan, as you would like to call it, and for them to really focus in on why building these trainings, building these pathways are so fundamentally important. So just the general process of your work plans, year one, as all of you know, it really started with the RTAD participation. So right now, we're in year two, that development of the HPET plan. And then going into year three is when you start implementing it. So like everything, you really need to have those different steps, starting with the assessment, knowing where everything is going, developing, and then implementing. So why does having a pathway, why is this so important? And we really just wanted to give some data, because I think all of us know the importance of grow your own, of, this is why the HPET plan is in the comprehensive workforce plan, but being able to give some data behind that is really important. So as you can see on here in the slide, nearly 60% of residents, they do practice within 100 miles of their residency. And then more than half stay in the same state. So if you can get people to come in to train in your health centers, that really is going to increase potentially the likelihood of having people stay there and go to work as full-time providers. And as the next bullet point says, over 80% of the National Health Service Corps and Nurse Corps alumni are still serving in those HPSA areas after 2 years. So that is a wonderful thing, again, to create that pathway to create your own or grow your own in the health center. Staff that opt in and engage in these learning and training programs usually have higher job satisfaction. And we've heard this many times, where many people, they really enjoy teaching other people, being part of that. So, it's a great way to also increase that retention of the providers that you already have in your health center. And, it can really just positively impact your recruitment efforts as well. It also has a really important return on investment. So as I mentioned, it really can increase the employee satisfaction, retention, and we're talking a lot about employee satisfaction, the importance of this, of people wanting to stay in the health centers, wanting to work there. and then lowers turnover. And, turnover is very expensive. So investing in those retention efforts in the employee satisfaction is really fundamental. It also lowers the time that it takes to fill a position. So as we saw in the previous slide, when you have a higher likelihood of someone staying there because they trained at the health center, then you really, the longer you have a position open, there is a lot of cost involved with that, the whole recruitment process. So the lower time that you can have to fill a position, that is wonderful. It increases the efficiency, really has that positive economic impact to the community, because also a lot of people who aren't from those communities want to go back, want to train there, and want to stay to serve the community. And then, as it says here, greater access to care, because obviously having those mission-driven providers, those who have trained in the health centers, understand the health center, what it stands for, the mission, all of those things really can offer that greater access to care. And some key considerations as you're talking to your health centers about why having the HPET plan is so important and why it goes into the total comprehensive workforce plan is that they do need to think about a few things. What are the need? What are those positions that you need to fill? What does the population you work with need? All of those things. So again, you really need to assess and look through what are those gaps, essentially. Your organizational culture, is it really established for the health professions, education, training, and ensuring that that is there? That it is the place that people want to go train, and those who already work there, that it is, that it's open for them to be able to be in these educational positions. For leadership, really need to have buy-in and engagement. They really play that key role of ensuring that these programs are in place. Obviously, as I said, you need the available faculty, and really you probably have a lot of people and staff that would be really excited to do that. And a huge part of what they see as their own professional development and something that they would really enjoy doing. And then obviously forming the partnerships as with any training program. And I will talk about that in a minute in one of the slides. Other key considerations to look at. Very important to take into account diversity, equity, and inclusion. We talk a lot about providers, but also all staff at the health center really reflecting the population that you work with. And that's incredibly important as well in the training programs that your health centers are setting up. And you want to ensure that anybody that you're bringing in, that you're training, understands these ideas, and that you're also creating a space that is equitable and inclusionary and diverse for them as individuals who are training there. Having the capacity for it, that it's financially feasible and sustainable. So again, it takes time, it takes planning, and this is why the HPET plan is so fundamentally important for your health centers. I mentioned the gap analysis. You have to look at what are the local and state requirements when it comes to developing these different programs, and then obviously it needs to align with your organizational strategy and objectives. So if your health centers don't have that, the HPET plan is the perfect way to do that. In the overall comprehensive workforce plan, that is something that you have to address. What are your organizational strategies? What are your objectives? And then you have the subcategory to go deeper into it in building these different training pathways. And as I mentioned, those partnerships in the community. So a good first step is really reaching out to the graduate medical education accrediting bodies and or local educational institutions in order to understand what the requirements are, how can you host these clinical students and the different graduate medical learners. And every single type of profession has different requirements and states have different requirements. So it really, for your health centers, it's important to be able to take the time, really do that homework, understand what goes into that, and then write it down, put it into a plan so that you can always go back, revisit, and to ensure that you're building a pathway. So I am going to pass it over to Nathalia. Sorry, I skipped to your slide really quickly. So yeah, please go ahead. Oh, no worries. Just one moment for Nathalia. And actually, while you're doing that, as I said, we really wanted to allow a good amount of time for the Q&A. So you can put your questions in the chat. Feel free to do that now if you like. Once Nathalia is finished presenting, you can also unmute yourself. If you're having any problems, you can also raise your hand and Mariah can help you out.
Thank you so much, Michelle. Hello, everyone. And thank you, ACU, for inviting me. I think that pretty much you all have clearly covered the intention of the HPET and how it aligns with the comprehensive work plan. And I just wanted to just reiterate that nuance because I think very early on, it became confusing. And what we started to notice, it was really the confusion was more around the nomenclature. So when you saw comprehensive work plan in your base funding, and then when you all got the supplemental funding, you were asking for the strategic work plan, I think that it just, people were interchanging the terms. And I think that things got lost in translation. So taking this opportunity to really stress that comprehensive plan includes that HPET plan. It is a part of it. It's not independent of it. It doesn't replace it. It is a part of it. And so it's very important that that as you're working with the health centers, you know, among all the other different components, that they understand that nuance of creating those pathways for all the different disciplines, not just for medical students or interns, but nurses, physician assistants, pharmacists, nurses, PAs, doctors, any of the clinical staff, and even administrators or people who run the front desk or any of those components that's going to help the clinics run efficiently, be able to treat and take care of our patients in our various communities. So I hope that through this presentation, that it's very clear, the nuance and the distinction. I don't have much else to say other than that, because I'm just going to co-sign what's already been presented. But I'll say this. Sorry for the confusion. Sorry that, in all of our wonderfulness at the government, that we put these terms out there that could really be confusing. So I hope that through this presentation, it's made clear. So thank you.
Thank you so much, Nathalia. And we do have one question. So let me go ahead. We have a question and a comment. So let me start with the question. It is from Ariel and says, can the HPET include items and roles that are localized within the state PCA? Or is it the goal to be unique to each and every health center?
Can you repeat that again? I'm sorry.
Yeah, absolutely. And if you click on the chat, you can also see that, but it says, can the HPET include items and roles that are localized within the state PCA? Or is the goal to be unique to each and every health center? And Ariel, if you would like to expand on your question, please feel free to unmute yourself.
That would be helpful.
Mm-hmm.
If she could speak.
Yeah, I don't want to assume what Ariel
right.
is asking.
Is she on?
I believe so. And Ariel, if you're not able to unmute yourself, what I was going to ask, Okay, that's what. So,
Okay.
not able to unmute at this time. Could you provide just a little bit more information in the chat, and that would be great. And what I'll do in the meantime is I'm going to go ahead and read the comments that we have. And then the comment says, so that is from Lourdes. It says, perfect. We just had a discussion at our PCA workforce meeting that we needed to get clarification on the comprehensive workforce plan and the HPED strategic workforce plan. And Lourdes was saying thank you for that clarification. And then I think Ariel may still be typing. If anybody else has any other questions, please, this is the time. We have Nathalia on the line, so we're happy to answer any questions that you may have. And again, feel free to unmute yourself if you would prefer. Okay, so Anne sent a question, or a few questions. It said, how will HRSA assess the adoption of comprehensive workforce plans by individual health centers? So Nathalia, I don't know if you want to answer that first part, and then I can read you the second part.
So how will HRSA assess this? Really, okay, can you hear me?
Yes, we can hear you now. Yep.
So how we're not going to necessarily assess each individual health center's plan. What we're going to assess is how you work with the health center to develop and create this plan. So basically, you will be reporting into us that, and I'm hypothetically, I'm just making this up. We have 35 health centers in the state, and we were able to work with 25 of the 35, and we helped them to develop these workforce plans. So our lens is more about how you help them develop a plan so that they're able to really address other workforce needs within their health centers. And to kind of go down to the other question, those comprehensive work plans are going to be individualized to it's going to be created to fit the needs of the individual health centers. So what may happen at the Flintstone Health Center may not be the same issues that's going to happen at the Barney Rubble Center. So you're working with these entities, sitting down with them and helping them to understand the components of having a plan to address their needs across the continuum of workforce. I hope that answered your question.
Thank you for that. Yeah, and there was a second part to a question, which I think is what you just responded to of, how does the center determine, how would those distinctions, how does HRSA determine that between the comprehensive workforce plan and the HPED strategic plan? And I think one of the important things too is that the HPED is part of the comprehensive workforce plan. It's it's one of the subcategories. And then Anne just finished saying, I think this part of it has been confusing. What exactly is the deliverable or resource HRSA wants to see at the health center level?
The deliverable is the comprehensive workforce plan, and assuring that a component of that plan speaks to HPET.
Wonderful, thank you. And yeah, that's why in the definition, when we looked at it, we thought the development section made a lot of sense to put that in there, because that's really what you're doing. You're developing your workforce. So Lourdes also has another question. She said, we are asking our health centers to include focus areas or areas of need for the health professions education training. Is that something that PCAs can share with HRSA for possible additional funding or programs?
Now, and I can't speak to additional funding. However, any type of feedback that you would like to give to us, we'll gladly accept it, because it is important for us to hear from the field what's realistic, what makes sense, because at times when things are developed at this level, it can almost come off as theoretical, truthfully. So we're trusting you to implement it. So if it's something that's not making sense, then please, you know, if you have other ideas, you know, that would be helpful, that also be used across the cohort, the PCA HCCN cohort, whomever, in support of these health centers, yes, please send that to us.
And Brian had asked just what does HPET stand for? So it's health professions, education, and training. And Nathalia, I don't know if you want to expand on that. I just made sure to put in what the acronym was.
Well, pretty much, we have a partnership with the Bureau of Health Workforce. And they really wanted to make sure that we had a designated workforce person in each PCA to help health centers in creating these career pathways to engage and improve a health center's readiness to be able to have those conversations and collaborations and partnerships with different schools to just bring an infusion of options in terms of staffing and clinicians, and also it helps to just expand the I want to even say the branding of the health center, you know, of being this place that's multidisciplinary that can treat, you know, many different types of patients, and not really and help to kind of also use this that sometimes that stigma sometimes that could come with a health center.
Wonderful, thank you.
Okay.
Sorry. Go ahead, please.
But also giving, you know, the PCAs an opportunity to kind of work specifically on some of those partnerships and helping, maybe even helping to broker some of those partnerships if they have a relationship, say, for example, with a university, that they could say, hey, you know, let me introduce you to, you know, the director of nursing, and we've been working with them for years. They do trainings for us. Let me introduce them to you, and maybe you all can establish a relationship by which there's nurse preceptors or something like that, just to give an example.
Thank you. And yeah, Nathalia, I think there was something really important that you had said a little bit earlier on, of just the partnerships, the importance of creating that connection, and that you look at all the staff in the health center as well. So it's about how do you ensure that the operations of your health center are working, and especially now with all the workforce issues that we all know about. I mean,
exactly.
So many presentations, you know, this is one of those ways to address that. So we have another question that says, thank you for the clarifications from Suzanne on comprehensive workforce plans versus strategic workforce plans. It says overall PCAs had to set their own definitions for both. Is that still okay? Or should PCAs start working towards a common definition?
So can you kind of expound upon that? Because it's very hard to just say a comprehensive plan is this when it should be tailored to the individual health center. So maybe not all health centers might need 10 components of a plan. Maybe they already have some components in place. So it's really about assessing where that health center is in terms of not only just the building the capacity to kind of bring in, you know, an infusion of staff, but also looking at recruitment, retention, like looking at the continuum. And you can't really put it in a cookie cutter box and say that is this one thing. It's going to require you to have an understanding of what it could be overall, and then come in and work with that individual health center, assessing where they are, assessing their readiness, seeing what they have. They may already have a work plan. Maybe that work plan just needs to be, you know, expanded a bit, or maybe it needs to be tweaked, or maybe they didn't add that whole HPET part into their plan. So it's not really a cookie cutter approach. It's really being specific and strategic and working individually with the health centers, because all of their needs are going to be different.
Thank you.
Sorry, I'm just going to get some water.
Oh yeah, no, please. take your time. We have a few other questions, so and then Suzanne did say that she was happy to go off mute to clarify and had another question. So Suzanne, feel free to do that. And then Anne, I did see that you provided another comment. So if we can have Suzanne unmute herself, and then Anne, I will go back to your comment. Oh, Suzanne, are you? Let me see. Feel free to unmute yourself whenever you're ready. And I could read Suzanne's second question, which was also for the efforts PCA do on both, what type of documentation would BIPIC expect to see? For instance, during a PCA site visit, is a tracking document enough with details on how information was gathered and entered?
I would say yes, and maybe some examples to just show, here's some examples of work plans that we developed with these health centers, because they're going to be individual. We don't need 35 work plans turned into us. What we need is for you as the organization to be able to tell us what it is that you did. You can show a few examples and really show how you worked with them, how you were able to course correct and or pivot in working with these organizations.
And Mariah, just so you know, I got a message from Suzanne. She's not able to unmute herself. She's able to see the video, but not unmute herself. So I don't know if you're able to unmute her from PCA HCCN.
Yep, Suzanne, you should be unmuted now, and I believe you just called in as well. So give it a try and we'll see if we can hear you. Suzanne, I think you might be muted on either your computer or your phone. It looks like you are unmuted in the Zoom platform though.
I'm just going to give it a moment. Yeah, for all this great technology, I feel like the muting and unmuting is always a bit of a challenge. Well, Suzanne, if you're able to at any point, and feel free to keep writing in the chat, that's perfectly fine. But if you're able to unmute yourself, just feel free to jump in. And we can definitely take more of your questions, or if you want to elaborate on anything that you asked. So Anne,
oh, can you hear me now?
Yes.
Awesome. Oh, the joy of technology. I just got a new computer, so it's figuring out how everything works together.
Yep.
So thanks for having this forum, ACU or STAR² Center, and inviting Nathalia. So the background on my question is, when we submitted our base grant applications, the instructions for objective C1 on comprehensive workforce plan said, like, you can define this for yourself. And so CCHN said, we think a comprehensive workforce plan has these 5 components, and this is how we'll judge it. And then when we got the HBET supplemental funding, we said, we think this is what a strategic workforce plan is. But there's been a lot of really great collaboration at the PCA level and with Integrated Works and others to kind of like, are there toolkits? Can we share resources? And there seems to be some more cohesion around some of the definitions, but it feels like it's still okay for PCAs to have their own definition based on the work they're doing, yes, what they know of their health centers. And
absolutely.
Verifying that's all still true.
Yes, it is, absolutely. Because what is happening in Colorado may not be happening in Massachusetts. And so you would definitely need to carve it out in a way that makes sense for the health centers within your state. You don't want us to design everything for you.
Wonderful. Thank you. And thank you, Suzanne. I'm glad it worked out that you were able to unmute yourself. So Anne said, I think that answers my questions, as she had the questions earlier, and then said, so that format that the format for the comprehensive workforce plan that each center adopts could vary, but the core is that the center has intentionally addressed comprehensive workforce planning and specifically has an HPET strategy.
Yes.
Thank you. And if I can, I guess this helps a lot because I think one of the things we were concerned about in our role as providing technical assistance is, and we were getting questions from health centers about, you know, might there be like funding that would come out and they would need to produce or, you know, show that they have a workforce plan that met certain criteria. So certainly we wanted to make sure that we were not failing to prepare our centers in some way because we just simply didn't have a good grasp on what they really needed to do. So this was very helpful and thank you so much for clarifying.
Oh, you're welcome. And unfortunately, no additional funds, but this is really a much needed business practice that all businesses should have in place. So that's another way to couch it.
And that's one of those things that we talk about where the turnover is so expensive. So the investment in this will most likely, I could probably say 99% cost you a lot less than what the turnover or having those vacancies may end up costing. So we have another question from Kelly, and it says, Nathalia, for both the comprehensive and HPET/strategic plans, I've been suggesting that health centers include documentation of the work they're already doing in those areas. It doesn't need to be 100% new work. I think this is important for a variety of reasons, including, sorry, I'm trying to, as I'm sharing, I'm trying to read that, including giving credit for work being done, and also to make sure those elements are included in quality improvement efforts. Does this align with what you're saying about the plans being tailored?
Absolutely. We wouldn't, if and I think I may have stated it earlier, if they've already had components or they've already had a plan, you know, they don't have to reinvent the wheel or create something just to satisfy this. You build upon that building block and the foundation that's already been set. You have some health centers that are already, you know, ahead of the curve. You have some that's not. So that's all a part of that assessment that you all do at your level in understanding the needs of the health center and helping them with this.
Wonderful. And Nathalia, I have to tell you, you know, in a lot of the workforce training, you know, the comprehensive workforce plan trainings that we do, as we're talking about it, we do get health centers like, oh, I already have that, or we're already doing that. It's just either it's not written down or, you know, didn't think about, oh, that makes sense to incorporate it into that. So absolutely. So, and Kelly said, awesome, thank you. And any other questions? So I don't see any other questions in the chat. Would anybody like to unmute themselves to ask questions? And if you are having problems, just send myself or Mariah a message in the chat and we'll be able to unmute you. So I'm going to give it just like a moment or two, if that's okay, Nathalia, to see if we get any other ones. And then I do have a few more slides, just like wrap up slides, so I can also go through that. And then if people want to ask questions, we can do that. I just want to check the time. So yeah, I think, and if we can give people a few minutes back, that would be awesome. So let me just wrap up. So one of the things that I really did want to get to this slide, because as all of you know, we do this PCA HCCN professional development series, and we really wanted to pivot to what we were hearing and what all of you needed in order to do this session. And thank you so much to Vivek and HRSA for speaking here today. But we did want to ask, what do you want to cover in the last session, since we kind of changed things around a little bit? So if you could just go back to the Mentimeter, and actually there may be a question. Oh, and Josie said, this was really helpful. Must drop for a health center meeting, but look forward to the materials. And as I said too, all of you are going to receive this PowerPoint, so you'll be able to have that information as well. So we would really appreciate if everyone could just, again, go to menti.com and let us know, what are you looking for that final session? We really, again, our goal is to tailor for what your needs are so you can go and work with your health centers. You know, it all trickles down to the health center focus. And I won't go back to sharing on Mentimeter, so I don't have to stop sharing and then do all that, but we'll collect that information on our end, and we would really, really appreciate all of you responding to that. And Suzanne, are you able to move to that slide in the Menti? I just want to make sure that people can answer this question.
Yep, I moved to it, and so everybody should be ready to go. It looks like we've got neck and neck, essential support staff, and then second is comprehensive workforce plan. So we'll leave that open for a little bit longer and make sure that, oh, look, employee wellness is coming in there, tying for second there. So we'll make sure that we are responsive to that. It looks like essential support staff is still first. And so, yeah, so we'll make sure that we get information out there and have that last session with the one that comes out to be first there. But as always, if you have any specific questions that we aren't able to address in this series, you can always reach out. And we also have a great idea of things to do on the next on our next funding cycle.
And seeing with the essential support staff, I mean, we hear time and time again how hard right now it is to recruit medical assistants, dental assistants. So this is another thing in that HPET plan, you know, the importance of creating that pathway, creating those training programs. And in trainings that we've done recently, one of the best ways really to retain the MAs and the DAs is to have those training programs, that development for them. So just really quickly, Megan said this was helpful. Thank you. And Brian, yes, actually the contact email, they are on the slides, but what I'm going to do is I'm going to give you our general contact, and that goes to me, and I'm happy to filter it as appropriate. So if you have any questions, feel free to send it here to info@chcworkforce.org. And again, if anybody has any other questions, we still have some time. So, oh, let me pull up. Oh, and Lourdes said, thank you. Brian said, thank you as well. And let me wrap up the last few slides. Oh, well, that was, we already went through the questions. Mariah in a moment is going to pop up the evaluation. We greatly appreciate if you could fill that out. Our next session, so depending on what topic one, it is going to be on June 6th, the same time from 2 to 3 p.m. And then just our final slides, we are doing a workforce symposium and a workshop. It is going to be in person, so it's nice to see people again. And this is one of the topics we're going to be talking about. So again, we really want to know what's going on in the field, what all of you need, and that's the materials that we develop. And you can always go to our resources. We have our retention and recruitment template that directly fits into your comprehensive workforce plan. All of that is accessible for free on our website, and the link is here as well. We have self-paced courses, podcasts. So that's really just to kind of round out that there's so many different workforce resources that we have, but you can always contact us at this email, and we are more than happy to offer that one-on-one TA and answer any questions you may have. So that really wraps up our presentation. I think we are about 9 minutes early. I just want to say, Nathalia, thank you so much for being here today. I always love when I get to present with a fellow social worker. I saw you have the MSW, so that's always exciting. Yes, that's another one, build that for social workers are so needed. So, put that in your HPET plan. And we may have one more question. Oh, and Anita said, great presentation. Thank you. But again, yes, thank you so much, Nathalia.
Thank you, and thank you for inviting me. I don't get to connect with our awardees much, so I'm really appreciative of this time. So thank you.
Absolutely. Well, thank you so much, everyone, for joining us. If you didn't fill out the evaluation, please go ahead and do that. And just to let you know, Nathalia, you're getting a bunch of thank yous in the chat. So I think people really appreciate that. And, you know, it's always great to hear from you. So yeah, everybody gets a few minutes back. And we're going to leave the poll open just to kind of wrap up. But if you filled out the evaluation, feel free to go. And if you have any questions, just let us know.
Thanks, everybody. Have a great day.